Hello friends, welcome to Nursing Basics. Today we are discussing about anatomical positions. A person in the anatomical position is standing erect or lying supine with the head, eyes and toes directed forward, the upper limbs by the sides with the palms facing anteriorly. Importance of anatomical position. All the description in human anatomy and clinical medicine are expressed in relation to anatomical position. All structures of our body are described in relation to this position irrespective to any body posture in space. Anatomical descriptions are also based on four imaginary planes that pass through the body in the anatomical position. They are median plane, sagittal plane, coronal plane and horizontal plane. Let's study about median plane. See the structure. Median plane is the imaginary vertical plane passing longitudinally through the body from front to back, dividing it into right and left halves. Second, sagittal plane. These are parallel to the median plane. They are named after the sagittal suture of the skull. The sagittal plane that passes through the median plane can be called as mid-sagittal plane. The sagittal plane which does not pass from center but passes parallel to the mid-sagittal plane is called as parasagittal plane. Then third, coronal planes. These are imaginary vertical planes passing through the body at right angles to the median plane, dividing it into anterior or front and posterior or back portion. These planes are named after the coronal suture of the skull which lies in the coronal plane. Then horizontal or transverse plane. These are imaginary planes passing through the body at right angles to both the medial and coronal planes. A horizontal plane divides the body into superior and inferior parts. Superior means upper and inferior means lower. A horizontal plane is also referred to as the transverse plane. Then we will read about terminologies used in anatomical position. Various terms are used to describe the relationship of parts of the body in the anatomical position. For example, the lung is superior to the diaphragm. If you do not know about the meaning of superior, then how will you know the lungs is situated above the diaphragm? So let's start with some examples. Superior meaning nearer to the head. For example, the lung is superior to the diaphragm. Inferior meaning nearer to the feet. For example, the stomach is inferior to the heart. Anterior or ventral meaning nearer to the front. For example, cornea is anterior to the lens. Posterior or dorsal meaning nearer to the back. For example, lens is posterior to the cornea. Medial nearer to the median plane. For example, heart is medial to the lungs. Lateral meaning away from the medial plane. For example, kidney is lateral to the vertebral column. Proximal meaning nearer to the trunk or point of origin. For example, the knee is proximal to the ankle. Distal meaning farther from the trunk or away from the origin. For example, the wrist is distal to the elbow. Superficial meaning nearer to the surface. For example, muscles of the thigh are superficial to the bone of femur. Deep meaning farther from the surface. For example, farther from the surface the femur is deep to the muscles of thigh. External meaning towards the exterior. For example, the sclera is external coat of the eyeball. Internal. For example, retina is internal to the sclera or choroid. Terms of movement. Various terms are used to describe the different movement of the limbs and other parts of the body. Movement takes place at joints where two or more bones meet or articulate with one another. Flexion. In this movement, two flexor surfaces come in approximation and angle of joint is reduced. Extension. In this movement, there is approximation of extensor surfaces whereby angle of joint is increases. Abduction. It describes the movement away from the median plane, away from the middle finger in hand or away from the second toe in foot. Adduction. It describes the movement towards the median plane or toward the middle finger in hand or toward the second toe in foot. Medial rotation. Medial rotation denotes movement toward medial plane or inward rotation. Lateral rotation denotes rotation away from the median plane or outward rotation. Circumduction. Combined movement of flexion, extension, adduction and abduction in a circular manner is termed as circumduction. Elevation. Rising or moving a body part toward the cephalic end is termed as elevation. Depression. Lowering or moving a body part caudally is termed as depression. Supination. It is the lateral rotation of forearm so that the palm comes to face anteriorly or forward. Pronation. It is the medial rotation of forearm so that the palm comes to face backward. Retraction. It is the backward movement from protrusion. Protraction. The action of extending a part of the body. Opposition. It is a combination of abduction, medial rotation and flexion. This movement characteristically occurs in the thumb as shown in figure. Inversion. Motion when an ankle is twisted. Eversion. Movement of the sole of foot away from the median plane. Plantar flexion. Movement in which the top of your foot points away from your leg. Dorsiflexion. Action of raising the foot upwards or towards the shin. For today this much. Thank you friends for watching. मिलते हैं अगली वीडियो पे.